Heart surgery has advanced incredibly, and a lot more options open to heart patients. We're joined now by Dr. John Schonder, who is a heart surgeon with Bronson Advanced Cardiac Healthcare. Good morning, sir. How are you?
I am great.
Now,
Jim, how about you?
I'm doing okay. Well, because I'm in the air conditioning now, so, there is that.
I got to beat the heat, yeah.
So as far as for years, obviously with heart surgery is advancing and whatnot, and we're talking about what's called TAVR, and I'm going to try to do this, is a transapical transcatheter aortic valve replacement.
Yes, it's a transcatheter aortic valve replacement, which in my 20 years of being an MD here, it's just amazing technology that we've been able to bring to Southwest Michigan so that our patients can stay in the area and get really cutting-edge care without having to travel many miles away to big institutions.
Now, there's another procedure for aortic valve replacement. Used to be you had to go through the breastbone, stop the heart, do it, and then start the heart back up. And for those who are laymen, that's not something you enter into lightly, stopping the heart, because you never know if you're going to be able to get it back again. But that moved on to what they call transfemoral TAVR, which is where you went through the femoral artery in the leg, right?
Yeah, pretty much. It has been sort of the holy grail for a lot of heart specialists for quite some time, because as you have said, open heart surgery by going through the breastbone has been performed millions of times through, about 3-4 decades now. But of course, as Americans are getting older, they're getting more frail, or they have other health challenges that really make the metabolic trauma of doing open heart surgery, although which is pretty safe, still prohibitive for them. So what we have done was leveraged what we've done for people with heart attacks, where we go up the leg and clean out an artery. Well, we just have a bit bigger device system where we could go up to the heart, approach it without having to stop the heart, put them on the heart-lung machine, and implant a new artificial valve through the old one, and they have a tremendous better recovery and a better prognosis. It's really a win-win for everybody.
Now, this new procedure involves even less invasive in that you just go through a small incision in the chest, and this is the I think you call it transapical?
Yeah, well, the whole system pretty much is one deployment strategy where we are doing this over wires and tubes rather than cutting the chest open. The traditional way, which about 95% of people are going to be eligible for, is where we still go up the leg. But there are people, for example, who've had survivors of lung or breast cancer, people who've had previous open heart surgery, people whose lungs are very bad, where just opening their chest up in the standard way or even going up the leg is just not very feasible. So what we do is we do make a small incision on the left side of the chest, and we're able to introduce our appliances that way, directly access the heart without all of the rigmarole that heart surgery and open heart-lung machine bypass requires. And that's where the cutting edge is right now.
Dr. Schonder, now am I pronouncing your name right?
Oh, perfect.
All
perfect.
Right. Dr. Schonder is with us. He's a heart surgeon with Bronson Advanced Cardiac Healthcare. Tell us in layman's terms, this really cuts hospitalization time down too, doesn't it? What's the average hospitalization for the new TAVR?
Well, you have to look at what the standard approach is. And in general, you want to look at about 5 to maybe 8 days on average for most people who get the traditional. For this, people come in the day of the procedure, and they're home usually in maybe 3 to 5, but the recovery time is really a lot shorter per se. I know some of our first patients for which I was happy to be in on their case, the one gentleman couldn't walk more than about 10 feet from his bed to the bathroom. Very next day, he was making 2 walks around our unit, at least 200 to 300 feet without a problem. It was just dramatic, like someone flipped a switch. And one other thing is that I'm not really a heart surgeon. I'm an echocardiographer. I'm more of a medical cardiologist. But this is one of the other benefits I really need to stress to you and your listeners is that, it's one thing just to bring a new technology to the area, but there's been so many side benefits. For us at Bronson to be able to deliver this it required us to look at our corporate culture, to look at how we do things. And I really want to stress we have a heart team. There's doctors like me in the trenches seeing patients and doing ultrasounds and non-invasive modalities. And once we see that they are a candidate for this procedure, we then bring them to the heart team. We have a dedicated valve clinic, which really, it's one appointment, and they see both an interventional cardiologist and a heart surgeon. They get two opinions. So time isn't wasted, their story doesn't have to be repeated, and everyone is on the same page. Then after that initial visit, we then maybe get CAT scans and a few other ancillary tests per our protocol. Then once these are all accomplished, we then sit down in a weekly team fashion at the table. There's myself, an ultrasound doctor. There's the interventional cardiologist, who's the main one performing it. There's a heart surgeon. There's a radiologist, anesthesiologist, and a member of the critical care team. And we go through every detail of this patient's case. We look at why they're a candidate. We look at the approaches, and we look at all their data. And I got to tell you, this multidisciplinary approach has brought many service lines really together, bringing them to bear for the benefit of the patient. And we talk about what are we going to do? How are we going to do it? What if something doesn't go as planned? We figure out everything at that time. So we basically have a good playbook that when that patient comes into the operating room, there are no surprises.
It sounds complicated, but yet with the healthcare system we have now, things just kind of run semi-smoothly around. Dr. John Schonder with Bronson Advanced Cardiac Healthcare. We appreciate you taking time out of your busy day to talk to us. And I'll tell you what, this sounds like another incredible advance that people are obviously going to take advantage of.
Well, thank you. I was excited to be able to share it to you and your audience. And, they can learn more at bronsonhealth.com. We have really put this out there so people don't have to travel many miles. And I'm very proud of how we have come together as an organization and as different departments, and even with our partners over in Lakeland Hospital to really provide an integrated, seamless solution for our patients.
Thank you again, Dr. Schonder. We appreciate it very much. Have a great day.
You too, Jim. Thanks.
All right, Dr. John Schonder from Bronson Advanced Cardiac Healthcare.